thank you, Alexis, my baby sister. No,
Oh.
um, there's so much to talk about when it comes to sickle cell and my journey. But as you mentioned, for those that don't know, sickle cell disease is a genetic blood disorder. So I have lived with it my entire life. I actually was diagnosed before I was born, while I was still in my mom's womb. They were able to do what I believe is called an amniocentesis and um, be able to diagnose me before I was born. And so my parents found out that way. And it was one of those things where I believe our dad knew that he had sickle cell trait, but my mother didn't know she had sickle cell trait. And so now they're faced with having a child that has sickle cell disease, um, and that really is another reason that motivates me. I'll say this now. That motivates me to be someone who is not only an advocate for sickle cell, but has really dedicated my life to learning about sickle cell disease and use that in my educational journey, is because there are a lot of people who don't know their trait status, and they don't have the informed decision making power that they could have. Similar to my parents, our father, and so that's another reason that kind of pushes me because I think everyone should have the access to that knowledge about their sickle cell trait status so that they can make an informed decision about their future offspring. Um,
Yeah.
yeah,
I'll say, I mean, I have seen sickle cell through, your lens. I've, grown up with you. But as far as just outside influence with sickle cell, I can't say that we talked much about sickle cell until I got into college and that they do the sickle cell testing or trait testing for student athletes. That was really my first experience, aside from my experience with you, hearing really about sickle cell. So by that time, you're 18, 19 years old going into college. Like that's kind of late to be learning about sickle cell,
yeah,
especially if you are a carrier of the trait or if you were, possibly diagnosed with it. It shouldn't take up until, you're well into your teenage years, well into your transitioning adult years to know about it. So,
yeah. That's a good point, Alexis, because one of the another things that we try to advocate and fight for is, we know there is a huge need for people who are in medical school to learn about it, but we just need public awareness to be heightened at a base. And there are so many people that may have heard of sickle cell disease but don't know much about it, or some people who may not even have heard of it. And if they have heard of it, their conceptualization of the disease is very I don't want to say problematic, but it's based on erroneous
mhm.
information. In 2023, sadly, there are still people who think that sickle cell disease is only a black disease and that anybody who has it has to be black, when that is not the truth. And so, yeah, I think you made a great point. I have been fighting, and I think that it is a great point of advocacy to educate people in K through 12 about sickle cell disease,
Mhm.
and encouraging children to know their sickle cell trait status. You don't, like you said, you don't wait because let's be honest, people still have children at 14, 15, 16. Unfortunately, however
Mhm.
you want to, frame that. But you can't wait till they're 18 to tell them that, about their trait status, because people are having children at these ages, that we're waiting. We can't wait until 21 and say, oh, now we'll tell them about trait status, when they should be knowing about it. And also, I want to also point out the fact that sickle cell trait is not, it is benign, but it's not as benign as people think. There are certain
Mhm,
risks that you should be aware of if you have trait. And so I think you owe it to your child, if they have trait, first of all, to know if they have trait, and then also to let them know, to be aware that there are a lot of people with sickle cell trait who experience sickle cell crises just like people with sickle cell
mhm,
disease. There are people with sickle cell trait who end up being diagnosed with a rare cancer called renal medullary carcinoma that's very, um, if I'm not mistaken, it can be treated if it's, found early, but it can also, um, be, a detriment to someone's health and ultimately be their demise. And then there's also things called exertional sickling. There's a lot of people who are in, as you mentioned, in athletics, who are in basketball, football, and other sports who just drop dead,
mhm.
during a conditioning training or during a game because they have sickle cell trait. And so, not to sound, morbid, but people should know, their sickle cell trait status so that they can understand some of these, risk factors, know the signs, and so if something happens or goes awry, that they're aware. So yeah, what you said is an important fact, and I think, the conversation about sickle cell disease cannot be divorced from the conversation about sickle cell trait. Um,
Mhm.
and then also to go forth with that, like I said, I touched on it earlier, but we do need a lot more people who are in medical school to be interested in treating sickle cell patients, not just hematologists, but we need people who are in every specialty to want to, take care of those with sickle cell, because sickle cell is a multisystemic disorder. It's a blood disorder, which means it impacts every organ of our body, right? There's no part of the body that blood does not affect. So if this is a blood disorder, that means that every part of our body can be damaged or affected by sickle cell. So we need nephrologists, we need ophthalmologists, we need, allergy doctors, GI doctors,
Mhm.
all of those specialties, um, to be able to be knowledgeable of how to take care of people with sickle cell disease who may also have other issues that may be an relation to their disease or not. Everything, is not always caused by sickle cell. And then also, we do need more people who are hematologists, doctors of the blood, who are specialists in sickle cell. I can tell you that even moving here in Houston, I had a problem finding a hematologist because there are a lot of hematologists who don't take care of sickle cell patients. They'll take care of leukemia patients and hemophilia patients, but they will specifically say, I refuse to see sickle cell patients. So we do need more of those. And I won't keep rambling. I'll let us move forward with the conversation. But these are a lot of, issues about awareness that really need to be addressed.
What do you think the reason is, or have they expressed a reason as to why they don't treat sickle cell patients, or they don't take the time to work with sickle cell patients? What's the reason?
Yeah, here's where I get on my soapbox. And this is where, I do a lot of my work as a doctoral student in research. And I was just telling, Alexis off camera that I was working on a paper today. Um, and I'm working on a research study about, basically how racism and sickle cell, the issues and the racialization of sickle cell disease. Um, and a lot of the reason I believe a lot of, hematology providers don't want to see sickle cell patients really stems from an issue of anti-Black racism. And again, this is not a dissertation proposal, video, but
At least not yet, you
at least not
know?
yet. So I won't go too far in the weeds, but I will say, again, because sickle cell disease is thought to be a black disease, even though it's not, and because the majority of the people in this country have sickle cell are black, a lot of the issues of anti-blackness that the larger African American or black population face are even more so highlighted in the sickle cell population. And so there are a lot of doctors who believe that sickle cell patients are rude, belligerent, hard to work with, they don't listen, inadherent, non compliant. These are a lot of things that even come up in research findings that sickle cell patients are just undesirable to work with. And a lot of hematologists and other doctors, especially, and I forgot to mention earlier, emergency room physicians, that's another topic. Um, a lot of problems there. But they believe these things because these are things that they're taught when they're in medical school. These are things that nurses are taught in nursing school, and they're told this when they're in their clinical rotations. And they may have encountered a patient who may have seemed to be rude.
Mhm.
But when someone is in excruciating, writhing pain for over 12 hours and they're just asking to be, relieved of that pain, sometimes we may not, ask pretty please with a sugar, with a cherry on top. And
Mhm.
so I think some of the the way people view the sickle cell population really stems from a lens of anti-blackness, and because historically black people are thought to be the angry, the mean, the
Mhm.
people who are rude and don't have manners. And so all of that bleeds into how people in the medical community view people with sickle cell disease. So that's a long answer to say I think racism is part of that, anti Black racism specifically. But also, again, going back to what I said earlier, just a lack of the miseducation and the lack of education about what sickle cell is, how to treat it,
Mhm.
what to do with it. And so I think a lot of hematologists who don't want to see sickle cell patients also just really do not know what sickle cell is and how to treat it properly. And so that's why we
Yeah.
need to have more fellowships to educate and train doctors in hematology and sickle cell. So again, so many things I could go into, but I'll save it.
All good, all good. I think that you touch on a great point. I think that we just have some communication differences, like in the way that we express ourselves. Um, I think that sometimes, what we see as being passionate, others may see as being rude or disrespectful. And it's just a different way of communicating. And as a healthcare professional, you have to deal with a lot of different people
Yeah,
from all different backgrounds. So I think that it's possible that maybe some diversity training would would help in that manner. But definitely, I've seen some of the textbooks and how they'll say that we're loud, say that we're angry, say even with different religious practices, like, oh, you're not going to be able to treat, a certain person, let's say they're Muslim, for example, you're not going to be able to treat them a certain way because of their religion. And I mean, that may be the case for some, but it's not the case for everybody. So I do think that we could do a little bit better in the way that we're training our healthcare professionals and really anybody. We just have different ways of communicating, and that's okay,
yeah,
and it should be respected.
yeah,
um, so, do you want to kind of go into maybe your experience with the stroke that you had when you were, younger, when we were at a young age here?
yeah. Um, Yeah, so as you know, I had a stroke when I was 2. And
Hmm.
so that was these again, as I said, this is a multi-organ, multi-systemic disease. And so because blood goes everywhere, you need blood in your brain. And so if you have sickle cells, which are stickier, more rigid, and sharper, than normal red blood cells, they can easily be clogged. And so um, I had a stroke, which a lot of patients do early in life at the age of 2. Um, and I will say, I almost kind of hate to say I was lucky or blessed because it's almost kind of like survivor's guilt to remorse, because there
Mhm.
have been other people with sickle cell disease who've had strokes who aren't. I'm really trying to choose my words wisely, because we all have um, our different path and experiences, but there's some people who had a lot more traumatic experience with their stroke. Uh, for me, of course, I don't remember anything when I was 2,
Yeah.
and I'm sure the stroke had something to do with that too. But I have friends that, are wheelchair bound or may have issues with mobility. I have very minor issues. I can't wiggle my toes on my right foot, as you know. And that's really the extent of the residual effects that have been left with me with my stroke. There are some other like cognitive issues that I've really noticed the older I've gotten, and especially since I've became a doctoral student. I'm like, I think there's a little cognitive issue right here,
Fuzziness
yeah, like
happened.
yeah, there's a little fuzziness, there's a little haze going on,
A
um,
little brain
a little
fog.
brain fog, and so I noticed that, but that just goes to show like just how severe this disease can be, that someone at
Mhm,
the age of 2 can experience a life altering, life changing stroke, which people associate stroke with people who are older, 40s,
mhm,
50s, 60s. They associate stroke with other comorbidities or like behavioral habits, but this us, our population, we experience stroke because of the nature of our disease. Um so really with that, I as at 34, I am noticing some things, and I've talked to my doctor, and we've kind of concluded it probably is cognitive effects because of my stroke. That was 32 years ago, but many of those who know about traumatic brain injuries and strokes, whether you progress or not, that stays with you for your whole life in
mhm,
some form or fashion. And so yeah, that also drives me, because there are ways that people can prevent children and even adults with sickle cell from even having a stroke. Luckily, I never had a second stroke, because there's even research that says the first time you have a stroke with sickle cell, after that, you are more likely to have a second stroke. And as you know, again, that's one of the reasons why I had to do blood transfusions at least once a month for about 16 years. So yeah, you were in the car sometimes where we drove an hour to Duke University from
yeah,
Fayetteville for me to get a blood transfusion. You've been in the room where they, had to give me blood transfusions, and that was to prevent me from having a second stroke.
mhm,
And so, yeah, I would I would be honest and say when I was younger, like in primary school, K through 12, it really didn't affect or bother me. Now that I look back on it, I look at how, like, all the things that was quote unquote wrong with me, and how I really it didn't phase me. Like, I wore a brace because of the stroke.
mhm.
Um, and people made fun of me, and it really didn't phase me at that time. It just, you know, now I think I was a lot more tougher as a child. Like now I'm very sensitive. Like, oh my God, they're talking about me. And
I
that's
also
weird.
feel like the culture is a little different too, because like when you're a child, like people just call it like roasting, and
Yeah.
it's just they just roasted you.
Yeah, they used to
But like
roast
now it's
me.
like, no,
Yeah, they
hold
used to
on,
roast me.
let's
Yeah.
be respectful here.
Right. Let's be respectful. So, Yeah, that's so true. So, um, those were like some of the effects. Like, so I wasn't very athletic. I wasn't very like, um, I wasn't out there playing football with the guys. I was in the home ec class making pizza rolls.
Yeah, you know, your handwriting was so nice, you
Yeah.
know?
I used to be in
But no.
I used to be in calligraphy class. Like, I think as a millennial or older millennial, I was part of that generation where we still had to learn cursive, and we actually had like
Mhm,
cursive writing classes, and that was my jam. Like, I could like go into the cursive writing class. It was like not an elective, but it was like a class you get to go in and josh around in. Like, you didn't. It wasn't like a class you went to the whole semester, but like while everybody else was outside playing and getting dirty and sweating around, I was inside like writing cursive on the chalkboard or helping my
mhm,
teacher clean the chalkboards off. Um, yeah, so uh, but just to wrap that part up, that the stroke is a huge issue, and these are other reasons that motivate me because I don't want the generations after me to have to experience what I experienced. So that's what really drives me to do things like this and to
mhm.
continue in my doctoral program, even though I'm every day I want to drop out.
You
Because
got this,
the
you got
the
this.
the there has to be more people committed to doing this work. And I don't meet a lot
Mhm,
of people that will say, I have always wanted to do research or work with sickle cell. Like, most of the people that I know doing research or working with sickle cell, they stumbled upon this community. It wasn't something that they desired to work in. And I'm not denigrating them. I appreciate that people choose to work in this community, whether it is research or as a provider or a
mhm,
social worker, whatever it may be. But also, we need more people who are fired up and dedicated to dedicate their lives to making sure that this population gets the care and respect that they deserve. But I'll let us
yeah.
continue on the conversation.
Yeah. Keep talking, keep talking. I think possibly with sickle cell being one of the diseases that are like an invisible disease, if you will. Like we can't look at you and tell that you have sickle cell. I think that that's where some people, kind of just end up forgetting about it, really, or pushing it off to the wayside. But just because we can't see what's going on with you doesn't mean that it's not still happening. Just like how you were saying with like when you're in the emergency rooms, they're thinking, oh, you're being irate or you're begging for, you just want some drugs. And it's like, that's not the case. Like, you're actually in pain. We just can't physically see
Yeah,
it. So
that's a good point.
keep talking,
Ooh, excuse me. That's a
yeah.
good point. And again, you've been there many times where I have been at the emergency room, like trying to convince them that I'm sick. And so that's a good topic to go to too, is that there's so many problems with emergency room providers and emergency room care for sickle cell patients. Um, and as you know, for those listening to this interview, I lived in Fayetteville, North Carolina for 16 years, and I moved to Texas, Houston, Texas, for grad school. And so last year in July was my first time. I moved here in 2020. Last year in July, 2022 was my first time I really had like a sickle cell crisis that warranted me to go to the emergency room. I waited in the emergency room for 28 hours before I was given, I was admitted like an hour or two after I was in triage. But altogether, I was actually physically in the emergency room for 28 hours before they were able to get me into a room. Um, that is unacceptable. And not just because it was me. Yeah, it's unacceptable because it's me. I will be biased, but no one, regardless if you have sickle cell or not, no one should be waiting in an emergency room for 28 hours. I am willing to wager the majority of the people who are in the emergency room didn't just come there just because they felt like sitting in the, even if it may not be a gunshot wound or, some type of, uh, injury that's comparable to that. People don't just come to the emergency room just to come. Even those who are unhoused, they come to the emergency room for a reason. Like there is not, nobody's just going to wake up. Oh, let me go to the emergency room today. And so I think really I don't know, like there's just so much. I think sickle cell highlights and exposes kind of the same thing that COVID highlighted and exposed for the
Mhm.
American healthcare system. We've been saying for decades, for years, that we need to expand Medicaid and expand healthcare coverage for those who are low income and, marginalized populations, and really just to all people. The way our healthcare system is constructed in the United States is really the basis and the antithesis of why a lot of these things happen. Um, because, if I come in the emergency room and I am at a pain of a 10 out of 10, and I've
Mhm.
been at home trying to manage it so I don't have to go to the emergency room. And the first thing someone says to me is, "Can I see your insurance card?" instead of, "Oh, we about to start an IV to give you pain medication." Nobody is concerned about an insurance card when they feel like they're about to die, but yet our healthcare system does not care, and you need to show your insurance card before. I mean, even if they don't ask it from you, like at the beginning of the
Mhm.
engagement, trust and believe somebody from billing is gonna come by your room with a little
With the cart.
portable cart while you sitting there with half dead, and they worried
Yeah,
about the insurance
and
card.
which one are we charging
Yeah,
this
and
to?
and so it just there. I really think we saw with COVID how so many people needed support, and we were like, oh yeah, that makes sense. Well, I think it's the same with sickle cell disease. There due to the nature of the people, the population that live with the disease. Of course, I said it's not a black disease, but out of the 100,000 people that we guesstimate to live in the United States that have sickle cell disease, I believe statistics say 90% of them are black.
Mhm.
And so, with that being said, that what is that? 90,000 people with sickle cell
Yep.
disease are black in the United States. But why is that? And now the our gracious host said that we could talk about race, so I'm gonna talk about it. I was given the license to talk about it. So um, we know that first of all, I'm gonna say this, Alexis, and I'm gonna wrap it up. Again, I am working on a research proposal that is like 35 pages. Sickle cell disease, scientists and researchers believe, originated in sub-Saharan and Western Africa about 73 to 7,500 years ago. Uh, it was not something that was found or noted in North America until the 1600s and the
Mhm.
1700s, when guess who arrived? Slaves arrived to the North American continent, and then also Southern and Latin America. And so that is when we see sickle cell disease leave the continent of Africa, leave uh, uh, South European areas and then also Northern Africa like Morocco, and then Southern Europe like Spain and
Mhm.
Portugal. Like these areas that historically had issues with malaria is where we found sickle
Mhm.
cell. Even in certain parts of Western China, these parts of the region of the world is where we saw sickle cell historically. that had nothing to do with North and South America. But until slaves were brought to those continents, then that's when we see sickle cell following. And so I say that to say is there sickle cell and race is inextricably tied in this country due to the fact that slavery has a lot to do with why it got here. Um,
Mhm.
and again, I'm trying not to make this a dissertation proposal defense, but also, so we have to know that a lot of the people who have sickle cell in this country are also the same people who have ancestors that were historically subjugated, that
Mhm.
were victims of redlining, that were victims of the Jim Crow South, that were
Mhm.
victims of, again, the institution of slavery, that were victims of eugenics, that were victims of forced sterilization, um, all due to their race. And so when people say, well, because I talked about providers saying that we're non-compliant. But when a provider doesn't understand that I couldn't make it to my appointment because I didn't have adequate transportation, because historically my family lived in an area of the state or the city or the county that was redlined in the early 1900s, right?
Mhm.
And I mean, redlining is no longer legal, but
You still feel the effects of it.
people of color still live in those red line neighborhoods today, 70, 80, 90
Mhm.
years later. And those neighborhoods still have food deserts, transportation deserts, housing deserts, if you will.
Mhm.
And so that plays out into your health. So if I live in a place where I can't get anywhere because there's no public transportation, and I live in a place where it's hard for me to go to school
Mhm.
because there's no public transportation. So now my employment opportunities are limited because my educational opportunities are limited. You see, it's a
Mhm.
snowball. And
Yep.
this is the unique situation of people with sickle cell disease, and you've seen it played out in my life. Um, and so all of that to say, because again, I won't get too far in the weeds, but it just to say that we cannot divorce race and sickle cell,
Mhm.
even though it's not a race bound disease. The way we
Mhm.
conceptualize a disease in this country is based on race. And we would be doing the disease or the population a disservice if we say, oh, we're going to be colorblind or we're going to
Mhm.
ignore people's race. Um, does that, and also because there people have said, well, what about the people who aren't black who have sickle cell? Even those who aren't black who have sickle cell face a type of like anti-black racism because I know, and even in North Carolina, there's a family in North Carolina that I met that are not black. They're white. They're, from my understanding, the mother's heritage is from Britain and the father's from
Mhm.
Ireland, or I might have it reversed. But every time that they have two children with sickle cell, every time they go to the hospital, they say that a doctor does not believe that one of their children has sickle cell disease, and before they treat them, they need to confirm that their child has sickle cell and do test. That is an issue, right?
Yeah,
Because
because that's time
that's
wasted.
time wasted, but that also like kind of is a reason from the anti-black racism, because if you're saying that you can't have sickle cell because you're white, because this is a black disease, that is also an extension of the issue of racism and racial problems
Mhm.
that is associated with sickle cell disease. So again, that is really the thing. And I said all that to go back to the emergency room. It plays out in the emergency
Mhm.
room so succinctly because it's the have and have nots. If you have private insurance, uh, you kind of have a little better off. You have a better probability to
Mhm.
get better care. But if you are someone who is poor, which most people, is 40 to 65% of people with sickle cell disease are at or below the federal poverty level. Um,
Wow.
and I say all of these. I'm spewing statistics, but all of these statistics fit my life.
Yeah.
And having my sister here, she can confirm that, like, I didn't have no money. I still ain't got no money. um, a lot of these statistics play out in the way I access healthcare. And so, yeah, the,
Mhm.
the emergency room is another one of those places where I'm very passionate about reforming, and making sure that not only just people with sickle cell, but everybody is able to get the care that they need. Because when you're in an emergency, you ain't got time for the BS. You want to be treated, and treated humanely, and everybody should have the right to that.
Yeah. Agreed. Agreed. Do you want to discuss a little bit about your 21st birthday and where you were at, where we were?
If I can, I would like you to describe your perspective of that, and I will come back and talk about it. How about that? Because I,
Okay.
I mean, of course we've talked about it, but I'm very curious to hear you talk about it in this setting.
Okay. Well, with Andre's 21st birthday, the majority of people at that age would be out having a good time, celebrating their birthday with their friends, possibly having a drink or two. That was not the case for Andre, though. That was not the case for you. Um, you are dealing with a sickle cell crisis, and that sickle cell crisis ended up putting you in the hospital. You were in the hospital, and then on top of that, you had pneumonia as well, and so you ended up having to be on a ventilator. They had to medically induce a coma um, on you. So, from an outside perspective, at the time I was 11, well, about to turn 11. I was 10. I was 10. And that's scary. That's not a nice sight to see, especially being that it wasn't a short time period that you were in there. You were in there for what, 2, 3 weeks?
I think it was
Like,
like three weeks. Yeah,
yeah. So, like, that was very, very scary. I'm sure, most people at this point have seen how scary being on a ventilator can be, due to COVID. Most people that go on a ventilator don't tend to come off of it. So being that you were so young, and the statistics that we knew at the time, the ones that we heard, you weren't necessarily supposed to make it past 17 years of life anyway. Um, so you being 21 in the hospital in a medically induced coma, like, that is absolutely terrifying.
yeah,
Like, um, we did visit, we did come see you, but you're seeing, like, it's not even you really, like, it's like a version of you, but
yeah,
like the liveliness that you have, this, we're used to you talking, we're used to you laughing, we're used to you, just kind of being the life of the party, being some energy, and to see you with no energy at all, seeing you laid out, seeing a machine breathing for you, that's not what we're used to.
yeah,
That's not what we're used to, and it was really scary. And then considering, like, you have no recollection, no memory of even turning 21, like on a milestone birthday.
yeah,
Come on.
yeah,
um, so it was a very scary time. We didn't know what was going on. We were hopeful, we were prayerful that things would be positive, and that we would see you again,
yeah,
and it did happen, it did work out. You're here to tell the story. But it really wasn't a good feeling, being in that unknown territory.
yeah. I, I'm glad that you said that, because of course we've talked about it, but like in this setting, it was helpful to hear your perspective. And as my sister said, um, first of all, if I'm not mistaken, my parents, to, and for full disclosure, I say this, not to delineate that she's not my sister, but Alexis and I have different mothers. She's still my sister
Mhm.
though, right?
I
But
see.
when I was born, my parents, my mother and her father, my father, were told that, if I'm not mistaken, in like '89, that you know, babies born with sickle cell probably wouldn't live past, I think, 12 or 13 at the time when I was born in the
Mhm.
late 80s. And then, every once in a while they'll say, oh, okay, 18, 17, 18. So, yeah, so first of all, to have even made it past that, because I will
Mhm.
say for a long time when I was younger, I didn't know, will I live? How long is this gonna last? And I think that that wears on you not only mentally but emotionally and spiritually. Um, so the fact that, and this is, and Alexis talked about, I don't have a recollection. So here's what I remember. I remember it was a big. So my birthday is March 20th, and so I do remember it was like the first week of March of, so 21 would have been 2010. Yes.
Mhm. Yep.
I would have been, so this was March 2010, the first week of March of 2010. And I started getting sick. I didn't feel well. And my parents took me to the emergency room. Now, we are a military family. So my
Mhm.
dad and my stepmother, Alexis's mother, were in the military. So we went to a military hospital on base. And I actually think I asked to go there because one of our regional hospitals in the city that we lived in is not a good hospital. So I tried to avoid that hospital at all costs. And if I'm not mistaken, I asked my stepmother and my dad to take me to the military hospital, hoping that I would get better treatment or faster treatment. And this is what blows me away. I went in, and they of course admitted me, but from my knowledge, I was, it was just a routine sickle cell crisis, but everything was going to be okay. But I think it was 3 or 4 days later, things started to go downhill. And the issue was there is a phenomenon within sickle cell called acute chest syndrome. And acute chest syndrome is basically, it mimics pneumonia. And so those who are not um, knowledgeable about acute chest syndrome and sickle cell patients will probably diagnose it as pneumonia. But it's not necessarily a pneumonia, but it's like a pneumonia like symptom. And so that was the issue. And I think the military doctors at the hospital just were not aware. So they did not diagnose me with pneumonia, not really treating me specifically for acute chest syndrome. And so after having acute chest syndrome for like 3 or 4 days untreated, then I started to decline. Um, I don't remember anything after that other than waking up, like, I think the day before, the day after my birthday, because if I'm not mistaken, I was released from the hospital on my birthday, I think.
Mhm.
But so from the beginning, from the first week of March until like March 19th or 20th, I was in a coma. And then, if I'm not mistaken, I was transferred from the military hospital to Duke University. None of
And you were.
none of this I remember. I'm giving you this story because my family told it to me. Um,
Mhm.
and so, and then I have a stepfather as well, and my mother. Both of my parents remarried. So my stepfather and my mother lived in Ohio at the time. I'm waking up out of a coma, and my mom and my stepdad from Ohio are sitting next to me in my hospital room in the ICU. So that is unfortunately, a common occurrence of people with sickle cell. And that is something that, as you said, I will never forget, but I kind of forget because I don't know all the details, because I was induced into a coma and on a ventilator. And so when COVID happened, um, people were shocked that I literally stayed in my apartment for what, I don't think I left my apartment for like 6 months.
No, we're using DoorDash, we're
Yeah,
using Grubhub,
because and my
things are being delivered over this way.
and Alexis knows, like, there would be times that she would come over, her or her mother, my stepmother would come over, and I would wave at them from the window, and I'm like, all right, I'll see y'all next time because I've been on a ventilator. I'm not trying
And
to
it's
be
no
in it.
joke.
It was not the most fun experience, because once they wake you out of the coma, they got to pull that tube out your chest. That does not feel good. Um, so yeah, I that experience, I can't even say it was traumatic because, as you said, it's hard to remember. And this may also sound weird, but my parents took pictures, and I guess my mom couldn't lost the pictures, and I forgot what dad said happened to. So like there were pictures, and I actually were curious to see them, but I've never to this day have seen any picture or any videos or any type of, you know, memorialization of that time because they've been lost. Um, just to be able to like patch memories together because I just don't know. So that was probably the most traumatic and most when you live with a disease like sickle cell, you are acquainted with near death experiences, but I think that was my most near death experience. And a lot of people with sickle cell experience that. And again, that is one of the reasons why I'm very uh, emphatic on fighting for sickle cell until the day I die, because there are just so many people who deserve to have their voices heard and deserve to have equitable and humane treatment. And there are a lot of people who experience acute chest syndrome that probably didn't have to, and they probably could have been prevented with other measures, if their quality of care was a lot better. So, anyway, I'm glad that you brought that up.
Yeah. It's, whew, it's had to keep it together over here. I got a little emotional. But yeah, like it was definitely a transformative like experience. Like after that, like before it, I definitely appreciated you. You know, you're my brother. I love you. But after, like the love just like was exponential because it's just one of those things like you never know the last time you're going to be able to say I love you to somebody, or you're going to be able to just hug them and embrace them. So after that, I it was a wake-up call. It was it was a wake-up call. So yeah, you know yeah.
Oh.
Yeah. So are there other experiences that you would like to share at this time?
No, I think those were like some of the main ones, and I'm glad you brought that one up. The stroke and then the acute chest syndrome, the stay. But as I said, I guess as we close, is that unfortunately, what we just talked about was not a one time occurrence. That was the only
Mhm.
time, if I'm not mistaken, that I was ever induced in a coma. But there have been several times that I've had acute chest syndrome. There have been several times where I've had pneumonia. There have been several times where I've had infections that were life threatening. Um,
Mhm.
this was before Alexis was born, but I had medical devices implanted into my chest called portacasts, and they're used for people with cancer, sickle cell, and other chronic illnesses that get a lot of IVs and blood work done to kind of cut down on the use of like your veins and trying not to make sure that your veins get affected. But I got one put in when I was very young, maybe like 4 or 5. It got infected, which they often do, no fault of the patient's own, really, because of the nature of these devices, where they're at, how they're how just germs work. But anyway, I got an infection, very sick. I ended up getting sepsis. This was like I was 5 or 6. So I think of sickle cell almost how sometimes you hear people talk about HIV/AIDS. A lot of time when people pass away, unfortunately, from HIV/AIDS, is not because of the virus itself. it's because of HIV/AIDS related diseases or conditions, right? The same for sickle cell. There's a lot of people who will say so and so died because he had sickle cell. I mean, yeah, they did have sickle cell, but most of the time, the sickle cell isn't the reason that they died. It is a associated illness or infection because of the sickle cell that, if that makes sense. So a lot of times people die from infections, and this is where we get penicillin prophylaxis. So when I was a child, even again before you were born, I had to take penicillin every day for years to protect me from getting infections, because that's why a lot of people died with sickle cell as at a young age, because they would get an infection. So that being said, I ended up getting sepsis and sick, and so they took the device out my chest, and then they waited, and then they put another one in on the other side, and lo and behold, that one also got infected, got sick, and I think I got sepsis again that time. And so after that, my mom and I and my family, we were like, yep, that's it, no more. And so people marvel that I haven't had a port device for over 20 years. Oh, probably over almost 30 years, because uh, that was just like a traumatic experience. I don't I would be so mad. This is the way I'm framing this. I would be mad to die from an infection if I had sickle cell. I'm like, this is why I died? Like like you mean to tell me I
Like,
lived
I
all
could
this
have
time
prevented
with
more quick
this
way.
life-threatening disease and I died from an infection that was preventable? No, I'm good. So yeah, I that's why I listen. If you're a phlebotomist, you need to know what you're doing when you're trying to draw my blood, because I'm not getting a portacat. But those are the things. Those are the things that people go through. And talking about it, when you live with the disease, and again, this is like me wrapping up. When you live with the disease, sometimes you forget how much you go through, how much is not necessarily normal, but that is part of your normal life. But to other people, that's phenomenal. Um,
Mhm.
and so these are the things that we go through, excuse me, with sickle cell disease. And it's just part of our everyday life. Um, but also, I think it is a point where we can educate people on how to be more involved, how to be more compassionate and advocate for people with sickle cell disease. And again, this is not just for me, but this is for the whole community. And even the work that I do, the work that other people do, I may not reap the benefits of it, but as long as someone behind me can, that's all I care about.